I'd like to call to order the Health and Human Services Committee meeting on Wednesday, January 30th. And the first order is the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Are there any members of the public that wish to speak? Oh, I'm sorry. Number 3, adoption of the agenda. May I have a motion? Moved by Commissioner Brown, supported by Commissioner Romano. It passed? Did it pop up? Oh, and it's passed 12-0. Number 4 is public participation. Anybody, members of the public that wish to speak? No members? Okay. Number 5 is the department recommendations. We have Mr. Cutler here to speak on grant amendments. We have number A, a budget amendment, Macomb Community Action Office of Senior Services, increase to chore services. Mr. Cutler, would you like to speak to that?
Thank you. Good afternoon. We have in front of you 6 budget adjustments today. They're all grant funds, no effect on county general fund. So the first one on the agenda is chore services. Chore is a program that we do with AAA 1B. They have increased our funding, so I'm just asking that the board adopt a budget adjustment in the amount of $18,918 for an increase given to us by AAA 1B.
Okay. We need a motion to recommend that to the full board, made by Commissioner Duze, supported by Commissioner Ha, and we have speakers. Mr. Carabelli?
Thank you. Real quick, I'm looking at this federal revenue, $17,812, in-kind $9,106, private donation is $8,000. You're asking an increase of $18,918
Yep.
increase to your budget. So where's that $18,000 coming from, the federal government?
Okay, no, $17,812 is coming from the federal government. We are increasing the in-kind, again, we have space, so it's just an accounting increase there, and then we're decreasing the amount of co-pays by our...
Okay, if I can say, so in-kind, you're saying that the county is giving the space of $9,106 at no charge, so we're giving it as an in-kind donation?
The county gives space to Macomb Community Action, along with other things, including time like yourself, that we are charged, our agency is charged to the indirect cost plan of roughly $1.9 million that we pay for all these things through the indirect cost plan, which the county gives us as part of our $3.6 million that you guys appropriate to Macomb Community Actions, includes the $1.9 million that I pay back to the county through the cost allocation plan, and space is included in that plan.
So that's the in-kind. The private donations are from individuals or corporations?
This is, private is from individuals, and this is a decrease of $8,000 in the contributions from our clients.
Okay, so your overall budget then would be the $18,918
Correct.
plus the 8,000, or is that included
No.
in there?
If you take down, for I don't know what you have in front of you, but if you have the full resolution in front of you,
Yes, I apologize.
you'll
So-
see the 3 changes in revenues listed under the revenue section. So I am increasing federal revenues, in-kind, and private donations. I'm decreasing for a net amount of an $18,918 increase.
And this funds are spent on what?
Currently, our chore services are done mainly for grass cutting and snow removal for senior services, but in the next year, we have added a whole line of in-home improvements. You've got to, first of all, you have to be a senior to qualify for these services, And we have a combination of funding here. This is from AAA 1B for chore services. We also have agreements with most of the communities in Macomb County to provide chore services through the Community Development Block Grant. The Community Development Block Grant provides...
I want to focus just on these particular funds, not the
Okay,
outside
well,
ones.
but I'm getting into the...
Okay.
The cost of, so, Community Development Block Grant only comes in for low income, where these chore services are for all seniors. So we're expanding the chore services beyond just grass and snow. We are expanding it into small minor home repairs within the seniors' homes.
And then they don't have to be CDBG qualified.
So AAA 1B is not CDBG required. So.
And your demographics where you're performing these services are where?
So what I do is I take the AAA 1B funds that they give us, and I have a census tract, and we allocate those dollars based on census tract. And then we add to that the dollars that the communities give us, plus the cost share that we collect from those communities to determine the number of dollars spent in each community.
And then the contractor who you award this work to is who?
I believe the number right now is we have 5 contractors that provide the snow services and the grass cutting.
And those go out for bid how often?
Every 3 years.
Every 3 years. And do you know when those are up again?
I believe next year. I think we're in the 3rd year of the contract right now, but I can check on the exact time frame of that. But it's, we're expanding the in-home services because of the need. We've had a lot of clients that have had drippy faucets and other things that would fit within this here, but we're doing that in-house with a staff person that we have already on our weatherization team.
Okay. And again, just a side note from me, and I'm sorry for belaboring this, I look at if you're CDBG qualified, that means there's an income level that you can't take care of some of the stuff yourself. And I think that that's a program that these people need, and that's why they have these programs. But if you're telling me that this additional funds don't have requirements, it could be for my grandma, who doesn't need it, but could get a free faucet fixed or her grass cut, I'm not so warm and fuzzy personally. I'm not speaking on behalf of any of the other commissioners. That's something I'm not a fan of.
I will say that with the changes that we're making and doing more of this minor home repair type things, the number of people that'll be getting their grass and snow done will be based on priority points, and priority points are going to be heavily aimed for those that are homebound, those that are already so everyone has to be over 60, but we have higher points. If you're 90, you're going to get more points than if you're 80 or 70 or 60. So we have different thresholds of points. So I think generally you're going to see that our agency is narrowing the focus into the more needy income-wise. We also use, I'm not sure if this is area medium income or percent of poverty, but we have those guidelines that add more points to the values. But if you're in a community that gives us money and you don't, so each community may be different on what priority points get you in there, because I've allotted so many dollars or so many units of care in the community based upon spreading the AAA allocation across all of the communities based on the census in those communities for seniors and the dollars that those communities give us. So there'll be communities for the AAA funds here that may be higher income because of less people in that community looking for those services.
Okay. And that's it for speakers? Okay. Are we voting? Please vote. Why, he did the motion prior. We did prior, didn't we? We got a motion prior. Yeah, before questions. Right?
As long as Mike says so. He's the one.
Mike knows. Okay. Item number B, I need a motion to forward to full board a budget amendment, Macomb Community Action Children and Family Services, a decrease in federal funding. Commissioner Drollet and Commissioner Kleinfeld. support. Mr. Cutler, would you like to speak with that?
This one is pretty simple. This one is a housekeeping one. The Community Services Block Grant gives us an award. They also allow us to apply for a second thing called Community Services Block Grant Discretionary. Our application this year was not accepted. When the budget was submitted, we were hoping and expecting to get this funds. So this is effectively eliminating the entire budget for CSBGD because we were not awarded CSBG this year.
It just came up. Commissioner Carbone?
Real quick, that $30,000 that you're reducing it by, am I correct?
Correct.
What was that going to be for?
So our discretionary funds, the current year that we have discretionary funds in, or the year that just went by, we had used it for a number of things, including stuff like board development. So we had brought in an outside trainer to develop. We have a advisory board, so we've used money across a number of things, but board development was one of the main items in last year's discretionary funds. They kind of give you a menu of things that they want our community services block grants to work on within those discretionaries. This year's application, the one that was not accepted, I don't know all the details of what we applied for, but they made decisions because, again, we've received discretionary for probably 6 or 7 years consecutively, and they generally only award it 2 out of 3 years. So it wasn't really surprising we didn't get it.
Okay, thank you. Are there any other questions? Please vote. Mess with my mic. Okay, agenda item 5C. Can I have a motion to forward to full board? Moved by Commissioner Brown, supported by Commissioner Leonetti. A budget amendment for Macomb Community Action Children and Family Services, a reduction of federal funding for deliverable fuel. Mr. Cutler?
Okay, again, this is more of a housekeeping item. Our total budget that we put into last year's budget packet that was approved by you was the $30,298. The low income and heating assistance program this year is not funding any deliverable fuel assistance. Just as a side note, this has been one area since I've been at the agency that we've always had trouble spending. We've spent a lot of resources with our community outreach, et cetera, because not a lot of people in Macomb County use deliverable fuel, which would be like kerosene and wood, et cetera. So we've historically had trouble spending this money and have given money back to let the other communities outside of Macomb County use it because we couldn't do it, because we couldn't find qualified candidates to receive those assistance. But this year, they've totally eliminated the program, not just for Macomb Community Action, but across the board. It isn't something that LIHEAP is funding currently.
Okay, thank you. Are there any speakers? No one is on here? Okay, thank you. Please vote. The vote passes 12-0. Agenda item 5D. Can I have a motion to forward to full board? Commissioner Giuse and supported by Commissioner Kraft. A budget amendment for Macomb Community Action Children and Family Services, a decrease in United Way funding. Mr. Cutler?
Okay. Again, a housekeeping item. United Way has quit using providing this service. This one does have some budgetary effects that go as far as what you approved in the budget. For the other two that I talked about eliminating were all services that we provided, not staffing. This one does come along with this reduction, having a cut in salary and fringes of $73,000, or salary and fringes of $73,000. As I mentioned last time I was in front of you, when we had some additional funding, that you were going to see these items coming in your pipeline. at our action centers, which provided a good portion of this service. One of our people resigned, and we are not filling that position at the current time. Again, we are understanding the budget constraints, et cetera. So in the elimination of this funding isn't causing us to have to lay anybody off because we had somebody resign. But again, I want to make you aware that this one did have a staffing effect to it. We have it looked at already internally.
Okay. Thank you. Commissioner Leonetti?
Thank you, Madam Chair. The person that resigned, what position was that we're not refilling now?
That person's title was, I believe it was field enrollment worker. So at our action centers, we have our staff people. There are customer intake support clerks, field workers, and field enrollment workers, and she was a field enrollment worker.
Okay. And you, before we knew this cut was coming, you weren't intending on filling that position, is that correct? Or now that the cut's here, we're definitely not going to fill that position?
We're definitely not filling that position currently. Again, with all of our funding, and you guys see me pretty much every meeting here with budget changes. Most of my programs have a lot of flow in their funding. Obviously, I put together what I think is a conservative budget. Unfortunately, I had a whole bunch of reductions here at the beginning of the year, more so than I've ever had in the past. But, and again, we staff accordingly. This is lowering the amount of man hours that we need to provide services. This person that was eliminated, that person that resigned, may have touched some of this, but wasn't a primary person in it. What's happening is her duties are being now absorbed by some of our field workers that we're doing this type of work. So again, it's a lot of a shell game of who's doing exactly what over there. But again, we're not planning to fill that position.
Yeah, and I noticed here, I'm looking, there's a lot of, as we go through the agenda here, I mean, this is 150,000, the next one's 18,000, and the next one's 291, and you noted that this is the most you've ever seen in the beginning of a year. You still think we're going to be able to maintain services? I mean, all these recommendations going forward indicate you can.
I've got another 5 currently in the pipeline that are all increases.
Okay.
So,
okay.
Again, it just happens that because when I built my budget, and again, I traditionally build a very conservative budget, and what comes in front of you should generally be increases. These were fundings that there was, maybe somebody had reason to suspect we were not going to get funding for it, but I had no good reason to not budget them as they were the previous years, because the funding, we were performing the services that were being done, and that I have 4 programs that I had to bring in front of you today was kind of shocking, but I can tell you that I've got increases funding in a whole bunch of stuff coming in front of you. I believe I have 7 items, 6 of which are increases right now in the pipeline.
All right, well, thanks for managing all that flow, Gary. You're doing a good job. All righty. Thank you, Madam Chair.
Thank you. Commissioner Carabelli? Oh, you decline? Okay, thank you. Are there any other questions? No? Oh, Commissioner Duse?
Thank you, Madam Chair. Good afternoon, Gary. I'm actually surprised about this United Way pulling out of this elimination of funding. Are they getting into something else? Are they using a different vehicle, or?
So this was a partnership that they had with Detroit Edison for us to help manage people's DTE delinquencies programs. So I would think that it probably has more to do with DTE than
United Way.
United Way is a very good partner. Actually, yesterday United Way they used our training and conference room in the Verkulen building for a large gathering. About 100 partners were there We have a regular relationship with United Way, and I don't think this has any real reflections on United Way.
Okay, that was my question. Thank you, Madam Chair.
Thank you. If there are no other questions, please vote. Did it come up? And that vote passes 12-0. Agenda item 5E, may I have a motion to move to full board? Commissioner Kleinfeld, supported by Commissioner Drollet. It's a budget amendment for Macomb Community Action Office of Senior Services, an increase to home injury control. Mr. Cutler, would you like to speak to that?
Yes. So again, home injury control is a program that's run through AAA 1B. And what we do there is in seniors' homes, this is an idea to avoid things like slip and falls, et cetera, where a senior could get injured and then end up with a long hospital stay, et cetera. So a lot of what we do here is the installation of bathroom safety devices, raised toilet seats, handrails in the bathroom and the shower. We also do portable ramps. So we got this approval of the increase. So if you look at the detail of the increase, you'll see that I believe it's $18,500 that we're going to use to buy these pieces of portable ramps. So at our agency, we have the ability to provide ramps that are permanent. So if someone is in a permanent need of a wheelchair ramp, et cetera, that we can do that. This is more of a temporary basis. So when people that are, first of all, it's seniors, but if I had a knee replacement or something where I'm going to be in a wheelchair for a limited amount of time is what we're targeting with this here. So we're using this extra allocation to increase our supply in order to provide more wheelchair ramps among the community. We found that to be a need in our community for the seniors. And again, the intention of these AAA programs is to keep the seniors in their homes.
Okay, thank you. Commissioner Ha?
Thank you, Madam Chair. Gary, you had indicated you purchase these portable ramps. Who installs them?
Okay, well, historically, we had an outside contractor that installed them. However, we have staff over at our weatherization program that are now doing these installs on these jobs. It requires multiple people because of the size of these units, and it's all modular. So you'll have your deck, like this podium here, and then we'll have units, and depending, of course, on the length, how much of a rise they can have, we might need 1 or 2 ramps. Also, how they're set up at the house. But we're currently transitioning from an outside contractor that we had doing it to having our staff do it.
Good to hear. Thank you. Thank you, Madam Chair.
Thank you. Are there any other questions? Commissioner Sauger?
Yeah, Gary, on a lot of these ramps that you install to some of these seniors, you get them back when they pass on, or?
Yes, we do. Actually, we have a community resource advocate that's supposed to visit them at least once a year after we have the ramp to make sure that it's still being used and all of that, so that we can transition them back. So we've had some that have been installed for a very long time, more of a permanent. So we are really working on making this more of a temporary and following up on the installation of the ramp to get them back out. And also, we were a little concerned that if I put in a ramp in 2019 and nobody goes back and looks at it, that between people riding up and down on a wheelchair 10 times a day and weather conditions, et cetera, that we wanted to have some inspection on that also. So we've added that into the duties of our staff, is to do at least an annual evaluation on all of our clients.
And you're mostly into 99% of your ramps are all aluminum, aren't they?
So, right, so through home injury control, that is what we're doing, is the aluminum ramps. But through our accessibility program, as I mentioned, we found that in Macomb County, there were a lot of seniors that were in danger of not being able to stay in their houses due to medical issues, et cetera. So we have expanded our community development block grant program into what we call home accessibility, and that's where we're installing permanent ramps. And we are having a contractor install it. So our staff does the design of it, but we're having an outside insured contractors that do those installations of the permanent ramp.
Thank you. Thank you.
Okay, thank you. Are there any other questions? No? Okay, please vote. And the vote passes 13-0. Our last item on number 5 is, well, first, can I have a motion to move to full board? Commissioner Sauger, support from Commissioner Romano. A budget amendment from Macomb Community Action Children and Family Services, a decrease in federal funding budget.
Okay, so a little historical background. So, Michigan Education Assistance Program currently has 2 sets of funding, one called LIHEAP and one called LIHEAP and LIEF, and they're just different funding sources, federal and state funding effectively. So while the one increased, the other one decreased. It was a net decrease, but it's been a separation of funding. We did put it in the budget this year as 2 separate funds. We did increase the other one. This is going to cause a reduction in direct assistance to your constituents. We figured it roughly at 136 less clients that we're going to be able to provide utility assistance directly to. And again, this has to do with the system that the state has put in and how that they're having people get their state emergency relief programs and how we are acting somewhat as a navigator in that system, and they have to be approved through them before we provide direct funding, et cetera. So the bulk of this, you'll see that of the 291,000, 245,000 is under operations or direct assistance, and the other $46,000 is in staffing reduction.
Okay, thank you. Are there any questions? No? Please vote. Vote passes 13-0. Thank you, Mr.
Thank you.
Cutler, for coming and answering all of our questions. Item number 6, is there any new business? Any commissioners with new business? No? Okay. Public participation. Any public participation? Okay, well, we're going to adjourn, and we need 5 minutes before we begin our next meeting. May I have a motion to adjourn? Commissioner Drolet and, Commissioner Leonetti, I'm sorry, I totally messed up your game there. But we have another one. We forgot about it. Okay.
Thank you, Gary.